Okay, so today I'm going to be priming IV tubing, and first I'm going to check the MAR to make sure that I have the right solution in the medication that I'm administering. I'm going to clarify any inconsistencies as well as check for any allergies that the patient may have. I'm going to also check the color of the solution and or medication and make sure there's no leakage and check the expiration date. And I'm going to make sure that I know the proper precautions and procedure for this administration before proceeding. And I'm going to gather my equipment and perform hand hygiene and put on gloves. So I'm going to go into the patient room. I'm going to introduce myself as their nurse. I'm going to ask for their name and date of birth as their two identifiers. And then I'm going to ask them again if they have any allergies that we do not know about. And if they do, like adhesive or tape, then we'll put that down in the patient's chart. And I'm going to ask if they have any previous surgeries that I need to know about and any allergies to anesthesia or anesthetics that we will use topically. And I'm going to explain that I'm priming IV tubing for the administration of their IV later on. So I'm going to ask if anesthetics are going to be used, and if they are, I'm going to check the allergies again, make sure they're not allergic to anything, and I'm going to choose a few different spots of IV sites to put anesthetics on just to make sure if I need to use another site in case one of them is not good. Then I'm going to allow time for that anesthetic to sit on there and take time for it to take effect. So first I'm going to take my primary solution bag and I'm going to label it with the date, the patient's name, the time, the solution type, and any other information that needs to be on this bag. And I'm going to check the expiration date, check the color, and check if there's any leakage, and we are all good. It's proper color, no leakage, and the expiration date is still good. So I'm going to prime the primary bag by taking this IV tubing. We're just going to use ribbon, but it's actually IV tubing. And we're going to invert the bag. So I'm going to take the cap off of this, which is sterile, take the cap off of that, and then I'm going to pretend that I spiked it, tape it, just to make sure it stays on there. And all the while the port is closed. Okay. And then I'm gonna invert it and fill the drip chamber 3/4 to halfway full by squeezing the bag or the drip chamber. And I'm not gonna let this touch the ground, the tubing touch the ground, because it is a sterile procedure and we do not want any possible bacterial infections getting into the tubing. So the port is closed, so this is sterile, so I'm gonna set this on a sterile setting. Put this to the side. And that would be hanging. I don't have an IV pole. So now I'm going to actually take this back. I'm going to prime it by opening the port and putting this in a trash can or a basket or anything that can collect the fluid. And I will open the port and let it flow so there are no air bubbles in the tube. So we'll do that, and then we'll close IV port and put this back on a sterile field. Okay. And now I'm going to take the piggyback medication. It says med, if you can see that. Yes. And I'm going to do the same thing. I'm going to label it with the patient's name, the date, the time, the solution type, and any other medication information that needs to be put on there. I'm going to scan both these bags in if needed, and I'm going to do the same thing as I did with the first tubing, but I'm going to do it in a backflow method as the priming technique. And I'm going to use this, as you can see, pink ribbon as the tubing. So I'm going to invert again, And I'm going to take this again with the port closed, and these both caps are open and they're sterile. So I'm going to spike the bag again, and I'm going to tape this. Okay. Again, not letting this touch because it is sterile. And I'm going to fill the chamber up 3/4 of the way or halfway full by squeezing, and then I'm going to keep the port closed for now, and then I'm going to hang this, but I'm going to put it to the side right now. So right now I'm going to bring my primary tubing here. It is hanging, right? So I'm going to need this one hand. And then I'm going to clean off this port, scrub it 10 to 15 seconds with alcohol just to make sure it's clean, and take the first port cap off. And then I'm going to hang this higher later, and then I'm going to attach the tubing to this. And this is going to prime the tubing by backflow of the solution going into the tubing with making sure there's no air bubbles. And then I'm going to open the tubing clamps and then open this tubing clamps and allow this to backflow. And this is going to prime. So once it's primed, I'll have the medications hanging higher than the solution, and these will be connected obviously. But then I'll open both clamps and allow them to merge together into the patient's IV, and I will make sure that there's no air bubbles and make sure that this is all sterile and not touching the ground. And I'm going to use the drip chamber to make sure that the rate is appropriate for the medication and the solution. And then I am done.